Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Everyone, listen carefully. When you hear the word depression, do not imagine only sadness. Think wider. Think of sleep that does not restore, appetite that changes without permission, concentration that slips away, fatigue that feels heavier than the body, and a mind that may begin to speak to itself in a cruel tone. Depression is not a character weakness. It is a clinical condition involving brain networks, stress biology, immune signaling, hormones, sleep rhythm, social environment, genetics, and, as research is increasingly showing, the gut. Why should the gut matter when the pain is felt in the mind? Ask that question and stay with it. How could organisms living in the intestine influence mood, motivation, anxiety, and mental energy? The answer begins with a simple but powerful idea. The brain is not isolated. It is in constant conversation with the rest of the body. One of the busiest conversations happens along the gut-brain axis, through the vagus nerve, immune molecules, stress hormones, microbial metabolites, and the chemistry of inflammation. Depression affects hundreds of millions of people worldwide. The World Health Organization estimated in 2025 that about 332 million people were living with depression. That number matters because it reminds us of something important. We need every responsible tool we can add to the treatment conversation. Not magical tools, not replacement tools, responsible tools. Probiotics belong in that category when used wisely, especially as an add-on to evidence-based care, not as a substitute for psychotherapy, medication, sleep treatment, movement, social support, or urgent medical care when safety is at risk. So, do this first. Remove the idea that probiotics are just digestive products. See them as biological messengers. See them as possible modulators of inflammation, stress response, intestinal barrier function, and microbial metabolite production. Now ask, why might that help someone with depressive symptoms? And how can it be used in a medically sensible way? Let us build the logic step by step. First, understand the communication system. The gut contains trillions of microbes. These microbes help process food, produce short-chain fatty acids such as acetate, propionate, and butyrate, interact with immune cells, and influence the metabolism of tryptophan, an amino acid connected to serotonin and the kynurenine pathway. Why does that matter? Because depression is not only about low serotonin. Modern psychiatric biology is much broader. In many patients, depression overlaps with chronic stress activation, low-grade inflammation, altered cortisol signaling, impaired neuroplasticity, disrupted sleep, and changes in reward processing. Now look at the gut barrier. The intestinal lining is supposed to be selective, let nutrients through, keep harmful signals controlled. But stress, poor diet quality, infection, alcohol overuse, sleep deprivation, and some medications can disturb the microbial ecosystem and the gut barrier. What happens then? Immune signaling can rise. Inflammatory molecules can become louder. The brain, which is deeply sensitive to immune signals, may shift toward fatigue, social withdrawal, low motivation, and negative bias. This does not mean every case of depression begins in the gut. Be precise. It means that in some people, gut biology may be one amplifier of depressive symptoms. A 2024 Nature Communications study on inflammatory depression examined the microbiota gut immune brain idea and highlighted links among gut microbial composition, short-chain fatty acids, inflammatory factors, and intestinal permeability markers. Do not overstate that as a cure. Use it as a clue. In a subgroup of depression, inflammation and gut signaling may form a loop that keeps symptoms active. So, how could probiotics help? Think of 4 pathways. First, they may help rebalance microbial signaling. Certain strains of Lactobacillus and Bifidobacterium can influence the microbial neighborhood, not by permanently taking over the gut like a new ruler, but by interacting, competing, producing metabolites, and changing the local immune tone while they pass through. Command your thinking here. Do not ask only, does this bacterium live forever in the gut? Ask, what signals does it produce while it is there? Second, they may support the gut barrier. If the intestinal barrier becomes more permeable, microbial fragments such as lipopolysaccharide can stimulate immune responses. How does that connect to mood? Immune activation can influence neurotransmitter metabolism and brain function. Probiotics may help by encouraging mucus production, tight junction integrity, and a less inflammatory gut environment. Third, they may influence stress biology. The hypothalamic pituitary adrenal axis, or HPA axis, controls cortisol rhythms. Chronic stress can push this system into dysfunction. Some probiotic interventions have been studied for effects on cortisol and stress response. Why is that important? Because depression often feels like the body is stuck in threat mode, alert but exhausted, tense but unmotivated. Fourth, they may affect neuroplasticity. Brain-derived neurotrophic factor, or BDNF, helps neurons adapt, connect, and recover. Some clinical trials have explored whether probiotic add-on treatment can influence BDNF alongside depressive symptoms. In one randomized, double-blind, placebo-controlled trial, patients with major depressive disorder received fluoxetine plus either probiotics or placebo for 8 weeks. The probiotic combination used Lactobacillus helveticus R0052 and Bifidobacterium longum R0175, and the study examined depression severity along with BDNF, cortisol, and ACTH. Now pause and ask, does the clinical evidence support this, or is it only a beautiful theory? The evidence is promising, but it must be handled with discipline. A randomized clinical trial published in JAMA Psychiatry studied probiotics as an adjunctive treatment in patients with depression. The trial was small, with 49 participants, and lasted 8 weeks. What did it show? Daily probiotic intake was acceptable and tolerated, and the researchers observed signals of symptom improvement when probiotics were added to standard treatment. Do not call that a final answer. Call it a serious signal. Small trials are like lights on a distant road. They do not show the whole city, but they tell you something is there. Meta-analyses give us a wider view. A systematic review and meta-analysis that included randomized controlled trials in patients with depression found that probiotics may reduce depressive symptoms and may also support certain cognitive domains. Another meta-analysis of prebiotics, probiotics, and symbiotics in depression included 13 randomized controlled trials with 786 participants and reported beneficial effects, while also reminding us that strain choice, dose, duration, and patient characteristics matter. Now, why do results vary between studies? This is where the topic becomes more interesting. Probiotics are not one substance. Saying probiotics help depression is like saying medication helps infection. Which medication? Which infection? Which dose? Which patient? Which duration? The effect of a probiotic is strain-specific. Lactobacillus rhamnosus is not automatically the same as Lactobacillus helveticus. Bifidobacterium longum is not automatically the same as Bifidobacterium breve. Even two products with similar names may behave differently. So give yourself a command. Read the label like a clinician. Look for the genus, species, and strain. Look for colony-forming units, or CFU, at the end of shelf life, not only at manufacture. Look for third-party testing when possible. Avoid products that promise to cure depression. If a bottle sounds too confident, become more cautious, not less. How should someone use probiotics practically in the context of depressive symptoms? Start with safety. If a person has severe immune suppression, a central venous catheter, critical illness, recent major surgery, short bowel syndrome, or is a premature infant, Probiotics require medical supervision. The National Centre for Complementary and Integrative Health notes that probiotics have a long history of use in healthy people, but safety data are not complete, and risk is higher in people with severe illness or compromised immune systems. Next, do not stop prescribed antidepressants or psychotherapy because of a probiotic. Do not do that. Use probiotics when appropriate as an adjunct. Why? Because depression can be life-threatening and treatment interruption can lead to relapse, withdrawal symptoms, or worsening suicidal thoughts. If there is suicidal thinking, psychosis, inability to function, or danger, act immediately. Contact emergency services, a crisis line, or a qualified clinician. Probiotics are not emergency treatment. Now design a reasonable trial. Choose one evidence-informed product, preferably one containing studied lactobacillus and bifidobacterium strains. Take it consistently for 8 to 12 weeks unless side effects occur. Why 8 to 12 weeks? Because many clinical trials in this area use that kind of time frame, and mood biology does not usually shift overnight. Track symptoms. Use a simple tool such as the PHQ-9 every 2 weeks, or write down sleep, appetite, energy, anxiety, bowel symptoms, and mood. Do not trust memory alone. Depression edits memory. Measure. How can you make the probiotic more likely to work? Feed the ecosystem. Probiotics are not solo performers. They need a stage. Add fiber gradually. Oats, beans, lentils, onions, garlic, asparagus, berries, ground, flaxseed, chia, vegetables, and whole grains. Add polyphenols, extra virgin olive oil, cocoa, green tea, colourful plants, herbs, and spices. Consider fermented foods if tolerated, yogurt with live cultures, kefir, sauerkraut, kimchi, miso, or tempeh. Move gently after meals. Sleep on a schedule. Reduce heavy alcohol. Why? Because the microbial community responds not only to capsules, but to the whole pattern of living. And be patient with the body. Some people feel bloating or gas during the first days. Start low if sensitive. Take the probiotic with food. If symptoms are severe, stop and consult a clinician. If there is no benefit after a fair trial, do not keep buying the same product out of hope alone. Reassess. Depression care should be compassionate, but it should also be honest. Now ask the deeper question, why does this approach feel so practical? Because it does not demand that we choose between brain care and body care. It says, treat the person as one connected system. The gut sends signals upward. The brain sends signals downward. Stress changes digestion. Digestion changes immune tone changes mood. Mood changes food choices. Food choices change microbes. See the loop. Then interrupt the loop at several points. This is why probiotics may be valuable, not because they erase depression, but because they may reduce some of the biological noise that keeps depression alive. For one person, the dominant driver may be trauma. For another, bipolar depression. For another, thyroid disease, grief, sleep apnea, alcohol use, inflammation, loneliness, or medication effects. So personalize. Ask, what is feeding this depression? How much is stress? How much is sleep? How much is isolation? How much is gut disruption after antibiotics? How much is diet quality? How much is inflammation? Then build a plan that respects the answer. So remember this, depression is not only a disorder of thoughts, it is also a disorder of rhythms, signals, networks, and body-wide communication. Probiotics may help by influencing the gut-brain axis through microbial metabolites, immune regulation, gut barrier support, stress hormone signaling, and possibly neuroplasticity. The evidence is not finished, but it is meaningful enough to take seriously, especially as an add-on strategy for selected people. Use them wisely, choose carefully, track symptoms, combine them with fiber-rich foods, sleep regularity, movement, therapy, medical care, and human connection. Ask why before you buy. Ask how before you begin. Ask what changed after 8 weeks, and never let a supplement replace safety, diagnosis, or professional treatment. Take care of the gut, but do not forget the person. Take care of the person and the gut often follows. Thank you for being here with me today. Stay well, stay connected, and take care of one another like family. I'll see you in the next topic.